8 minutes gone after 7 p.m. You're in tune with Zimbabwe's #1 music station, Power FM Zimbabwe. Now it's time for Under the Shadow, facing addiction head on. It's all about real stories, real struggles, and giving you real hope. Only on Power FM, where legends live. A hard-hitting, eye-opening conversation on addiction, recovery, and hope. And on the show, I am interviewing Jacob Shamhuyarira. He's the founding trustee at Pamvuri, a private voluntary organization. Welcome to the show, Jacob.
Thanks, my brother. How are you?
I'm great, thanks. How are you?
Not too bad. Not too bad.
How was your journey here? Did you travel safe?
I did.
Nice. Now, let's talk about it real quick. Now, the reality is that drugs and alcohol have engulfed our young people. And you are at the front of tackling this crisis. What drove you to take an active role in this fight?
Well, I think I've shared this story so many times, it just rolls off my tongue easily. So, well, I got into this work out of lived experience and out of passion, fully out of passion. So I struggled with addiction between the ages of 15 and 29.
Okay.
And I'll say the last 3 to 4 years of my drinking were quite bad. So I started off with alcohol, then later on, now getting more into cannabis as well. And I just got to that point where the reality is I was looking at one of 3 guaranteed outcomes in my life if I had continued, jail, hospital, or death. So, yeah, I knew I had to stop. I knew I had to find a new way of living. And then when I gave up, I figured that there's so many people out there who need, at least access to the information on what the problem is and what the solution is and where they can find the solution. So that's really how I got into it. And ever since we got into it, it's opened up so many avenues, so many opportunities, getting to learn more, getting to meet exciting people, getting to hear exciting stories as well. So yeah, that's the short answer.
Oh wow, yeah, still very powerful right there. But let's take us back. How did alcohol become a part of your life, and when did you realize that it was a problem?
Well, like I said, I was only 15 when I started at school. It was a sports day, and I remember one of my friends came with a bottle of vodka, and then we mixed it with our cool drinks. I certainly didn't like the taste, but I loved the feeling.
Oh no.
I wasn't a very confident boy at the time. I wasn't sure what life was all about. But when I drank it, wow, it just gave me that sense of ease and comfort. And I spent the next 14 years of my life pursuing it. And to answer the question on when did I figure out that now things are getting out of hand, like I said, I think it was the last 3 to 4 years where I knew I had developed a problem. Personal relationships had gotten messed up. So many bad decisions in my life. A lot of things were just not going the way they ought to have been. And having realized that things are not going properly, I needed to do something about it. That's when I figured that, even if you have the desire to stop, even if you want to stop, if you don't have the information on how exactly to achieve it, you'll probably still struggle until you get the requisite help that you need. So I think that's what accounts for the period between realizing I've got a problem and then having finally gotten the solution. Yeah.
All right, so addiction, if not always, often leads to rock bottom moments. What was the worst experience in your struggle with alcohol?
So one thing I figured out that, with rock bottoms, you can even get a rock bottom of a rock bottom of a rock bottom.
a bottom of a rock.
Yeah. If you don't make the necessary changes, the rock bottoms keep on coming. And even in recovery, I've been sober for the last 8 years. And I've discovered that, rock bottoms can still continue happening, even on that journey to recovery. So what I would say was big rock bottom for me, or a great point of reckoning, was when I figured that a lot of things I detested in a human being were now embodied in my person. I had become those things. A lot of the things that I'd said I would never do in my life, I had done. A lot of places I'd said I'd never be.
Go?
Yeah, I did. I did end up there. And I recall one day having had a drink. We're drinking in very close to home. And the next recollection I had, I was on a farm in the farm service quarters in a plastic shack in Banket.
Oh, right.
There are recollections, the hazy memories of how we ended up there, or how the decision to get there started. And then I asked myself, what's this now? So for me, that was a scary moment, and that's when it hit home that I needed to change. A lot of people who were close to me had given up on me. They'd said, nah, there's no way that we can,
stay with you or watch you going down this road.
Yeah. Relationships had broken down. So many things had just gotten wrong. So, I think for me that was one incident. Like I said, to achieve a rock bottom, there's so many
levels,
that happen. While in active drinking and even in recovery, you get things that the alcohol is gone, but you can ask yourself, how did I make this decision? So it's a lifelong battle from what I figured out.
Oh, wow, touching. I know I laughed a little bit, but there is absolutely nothing funny about that. And addiction affects families deeply. You talked about hitting close to home. How did your family react? Did they notice? How did it impact them?
So in a very big way. They were affected, and I'll say maybe they still are affected, still coping from the recovery. The journey itself is quite long, even though I've been in the recovery plan for about 8 years now. But it definitely affects family when they see possible potential, great potential in
relapsing
in a loved one, and then it's just not happening. So it definitely affects them in a way. People get angry, people get confused. Wait, what's wrong with you? You had said you'll do this. We thought we had managed to get over this, but we still find ourselves in the same cycle. So it definitely does affect family. And, I've seen in the work that we do a lot of family members relating their own experiences, and you can see, this thing really, really affects people in a very, very bad way. Addiction does affect the individual, the family, and community as a whole. So, it needs to be addressed at that level as well.
All right, so let's talk about some of the gateways or the openings that can lead you down a path of addiction. They do say that show me your friends and I will show you your future. What role did friends play in both your addiction and your recovery?
Well, before we get to the friends, I think I would like to touch a bit on society as a whole. Which is why even the national response is looking at society as a whole, the whole of government and the whole society response to the disease. Because if we're to look at, for example, how alcohol messages are put across to us through movies, through sport, through advertising. And it's not just alcohol, it's the different drugs, cigarettes, different things are advertised quite aggressively. Then we also have role models in society, drinking publicly. And I'm saying we have role models at a celebrity kind of level, and then you've got role models as an aunt and uncle, or,
homestead level.
Yeah, so I don't see so many adults drinking around us as kids. So you wouldn't have a problem with making a decision to drink when you're finally offered that drink, because
it's
acceptable. It's acceptable. You see your favorite football star advertising drinking.
Your favorite rapper. Chatora Mazita.
Yeah,
Chatora Mazita.
All sorts of people of influence drinking. Sports brands, local football sponsored by alcoholic brands, international football sponsored by the same
huge events.
There's so much. Sports days at school, church events. I come from a church where drinking does happen. So you see all those things. I see all those people. As a young boy, I think people underestimate the influence that it has on people. But kids are impressionable.
Yeah, very.
Yeah.
Very.
So when you see all those things happening, it leaves very little room for defense when the opportunity to drink gets to an adolescent. So I would say society did play a role from that perspective. And then the issue of friends. Like I said, at school, a friend of mine came with a bottle of vodka and we drank it. Peer pressure affects, I think people underestimate the impact it has on young kids, but definitely,
that's got a lot.
It does have a great impact. So we friends got involved, and even when I wanted to give up or to slow down, you'll still have friends calling you, hey, there's this activity happening, come, let's go, let's enjoy, let's do these kind of things. So I think there is need for support at all levels when someone wants to embark on a journey of recovery, to get adequate understanding and assistance from people around them, so that they can at least have a chance of recovery. When you have people not understanding what's going on, people questioning exactly what it is. And I think one other thing I figured is the way I drank, my friends also did the same. So any change in my behavior is an indictment on their own drinking. So they would question, okay, so if you have a problem, are you suggesting that we also have a problem? Yeah, so they wouldn't want to have that opportunity to introspect.
Oh no.
Yeah.
0712-831-172. Jacob Shamhuyarira right here on Power FM Zimbabwe. We are talking about facing addiction head on this show right here we like to call Under the Shadow. And please note, guys, in the next hour we'll be having a very, very, very special program. It's called The Power of Love with Delani. Every Tuesday night between 8 p.m. and 9 p.m. we're going to dive deep into the heart of love, relationships, and everything in between right here on Power FM Zimbabwe. Now on our action line, we are available to talk to you guys. We're also there on the WhatsApp platform 0712-831-172. Thank you, God. Thank God you are on your way to recovery. Majority are committing suicide. That one coming in from a number that ends in 1872.
That's true.
Nandidi.
That's true. It's nothing short of a miracle. Yeah.
And you coming out of that dark place is also, a testimony that if you are listening right now and going through such a dark spot, you too can make it out. Now, you coming here means that you're also helping others battle addiction. Tell us exactly what you do through Pamvuri PVO.
Right. Thanks a lot. So our journey, we're in our third year now, having registered as a PVO in 2022. And the first thing that we wanted to do was to cover that knowledge gap. What is the problem? What is the solution? A lot of people don't know that. I think there's a misunderstanding on exactly what addiction is. We believe it is a disease, and it's very important for that information to be
passed on,
shared across platforms, because people do think it's a moral failing. People think it's kujitisa and all sorts of things, but so number one, that's what we're doing. So we do a lot of psychoeducation, educating people on exactly what this is. Then we have developed a referral pathway through a helpline number, where we help people access help, get information on where they can get the help that they need. So we've got people who are always picking up the phone, try to understand what the condition is or what substance someone is using. And then we refer them to services that are available to them in terms of geographical location, in terms of the city that they're in, as well as expertise that's relevant to the condition that they're trying to deal with, and budgets. Because some services are free and some services are paid for through the organizations that exist. Then we have also looked at work around community reintegration. When someone is coming from rehab or a facility where they had been locked up, maybe, but some people do end up in correctional facilities, and when they come back, there is that I definitely need to refer them or direct them to support groups where they can sit down with other people who have gone through similar experiences and who've got similar goals in terms of what they want to achieve with their recovery. We have an exciting partnership which has just landed on our portfolio with a financial institution to build capacity building on financial literacy. So our very first activity will be happening on the 21st of March in Highfields. We'll definitely share more information on that. It's now building financial capacity among people who've recovered from addiction.
Nice.
So that's it will be in commemoration of Global Money Week. So we are quite excited about that.
Oh, congratulations.
Thank you very much. We also have an adolescent program which we've been running.
Nice.
It's nearing its end now, but we hope to keep it going. Yeah. So that's when, in partnership with Grassroots Soccer, we're looking at preventing, informing kids on mental health issues through use of football. So we use football examples. So it's been quite an exciting journey. We've been running it in Harare and Bulawayo. So yeah, I mean, we've been doing quite a lot. We've got training programs, we've got messaging programs, stuff like this that I'm doing now with you, getting into the media, discussing addiction, getting people to find help. So yeah, that's really what we've been doing and what we love doing.
Oh, wow, thank you so much. I'm loving that, especially the part where you are going to the adolescents. We might be able to end this disease yet, we might be able to end this disease in the bud before it goes any further. And now you've been talking about what you guys are doing. What are you seeing in the trenches while you're doing what you love doing? What real life stories stand out that show the depth of this crisis?
Yeah, the crisis out there is real. The challenges that people are facing with the disease of addiction are quite massive. We see it in the news, see it being posted on different platforms where there's domestic violence, which is prevalent and aligned to the disease of addiction. There's crime, there's disease, there are all sorts of things that are happening as a direct result of all this substance use. Sexual abuse, it's massive. So I mean, as a country, we need to do a lot. But what the government has done so far is quite commendable. I don't know if you've had access to the National Drug and Substance Use Plan, which was recently launched last year.
Okay.
Government has identified 7 pillars through which these challenges can be tackled. One pillar is looking at supply reduction, trying to deal with drug dealers, curtailing the supply of illicit substances into the country, and also regulating the operations of liquor suppliers as well. So a lot of work is happening on that front. Then we've got the demand reduction pillar. Like I said, an activity like this will fall into that.
Okay.
Because as we talk about these problems, as we sensitize people about these issues, it creates an opportunity for someone to identify the disease within themselves at whatever stage they're in, whether they're still at experimentation or it's now full-on addiction. Just having this information from someone who's been through it and who's pointing them to say, okay, look, with the way things are happening now, you could probably end up in this place, or you have an opportunity to come meet with us at this place, and this is how we can help you. This is how we've managed to overcome our problem. It definitely helps. Then there's the harm reduction, treatment and rehabilitation pillar, where people who are still trying to continue drinking or taking whatever their drug of choice is, there are interventions that can be done to minimize the harm that may be inflicted upon them or upon others, upon other people.
As a result of them.
As a result of their actions, yeah. So, ausatoda kumira zvako but wakwanisa kubatsira kuti ma impact yako ite less. Yeah. So there are various interventions there. I mean, there's a lot to talk about that as well. 7 May is the World Harm Reduction Day.
Okay.
So we will be coming up with more content around that.
I'm putting that on my calendar.
Definitely.
7 May.
Yeah, happy to come back and discuss more about that with colleagues who are working more in that space. Then we also have the community reintegration pillar, which tries to help people settle back. You may have left the community physically through rehabilitation or correctional facilities, or you've just left society through self-isolation. Because when someone is using drugs and alcohol, there's a great deal of self-isolation that happens there. Or you get isolated by the family because they don't understand what's going on with you. They don't trust you anymore. There's a lot of things that happen. So there's a lot of reintegration work that needs to happen. And part of the reintegration also includes the financial inclusion, financial literacy, and all those skills, which I keep on mentioning the program that we're launching, that we're starting soon, in terms of helping those in the underserved communities, which include people recovering from addiction, accessing those services and skills. And once a track record and credibility has been established, there can be access to financing. So nice. We're working with experts in the financial services sector. So, like I said, it's quite an exciting journey for us. And then after community integration, there's the media pillar, which again is this exercise that we're doing, talking to the general public about the disease, about the solutions, about opportunities, about programs that people can collaborate on. There's so many programs that can be done at micro and macro level. Then we also have the legal and policy pillar, which looks at harmonizing the laws to make our drug response more effective. There are people who are technically well-versed, in that space. So there are policies that need to be put into place. For example, in Zimbabwe, we do not have a national alcohol policy. So there's work around that that needs to be done, and we are also involved in that through some of our partnerships with some of our global partners. I'm sure you may have heard about a case which was in our courts at some point, where one of the lawyers argued that crystal meth is not a drug, and the drug is not an illegal drug. No. So there was need for people with that expertise to, align the laws to ensure that, you can't have people trying to defend
that.
No,
it kills us.
It definitely does.
It takes us back.
Especially if you look at the harm that
it has done.
In communities out there. I don't know how people do it, but yeah, it was done. Then we also have the seventh pillar, which is the resource mobilization pillar. There is a definite need for resources in this fight. It's a long-term battle to deal with addiction within an individual. Now, if you look at it at a macro level, at national scale, you do need significant budgets in terms of the efforts that need to be put into. So that's a pillar where a lot of work is being done as well. And I think with recent geopolitical events in the US cutting support that they've been giving to other countries, some of the initiatives and interventions that were already lined up they've been affected. So there is need for new strategies to be put in place on how we can solve that problem of financing the fight. So I mean, there's a great deal of work that's being done at national level. And as organizations, we were invited to be part of the process at a high level. Last year, the plan was launched by His Excellency the President, which was great. I think it shows a great political will when you have the President, the Vice Presidents, the Minister of Defense chairing the whole national response, and several ministers being part of that. It shows that there's
huge buy-in.
There's huge buy-in, and then complementing those efforts are now then complemented by local and international NGOs coming in on the ground, seeing what can be done to help prevent the occurrence of addiction among adolescents, and then when someone gets hooked, how they get access to information on where they can get the support that they need. And also equally important is for families to access the information on what exactly is happening with their loved one and how they themselves can get support. Because it said the average person who uses drugs and alcohol affects negatively at least 20 people around them. And when I did my count, it was huge. It was massive.
More than 20.
Definitely more than 20.
Well, it sounds like you are doing something to fix your sins, and I have to commend you. Thank you. That's all I can say. I don't know what more I can say, but thank you. I mean, you can't do this alone. You've spoken about the government, you've spoken about local and international agencies coming through to help you. But who are your key partners in this mission, and how do you collaborate with them?
Oh well, we've got a lot of partners that we've worked with over the years, and we're still working with quite a lot of them. The World Health Organization at local, regional, and international level, they've come in strong to support the work that we're doing, both technical and material support, and we're quite grateful for that. The government of Zimbabwe definitely. The various ministries, we have an MOU with the Ministry of Health and Childcare. We work closely with the police, with the prison services, Ministry of Education, various ministries, Ministry of Public Service, Labour and Social Welfare. We do quite a lot of work with them. At provincial level, Harare and Bulawayo, both ministries have been quite influential in the work that we've done. They've supported us. Private sector, so many companies, lenders, Park Finance, they have come in strong. Coming up with the partnership that we're looking at, starting off with Global Money Week next week. We're quite excited about that. It's been amazing. Grassroots Soccer, they are a US-based organization, but started off in Zimbabwe, in Bulawayo. Yes, they started off in Bulawayo. And we've done quite a lot of work with them over the last year, working through the adolescent mental health promotion and prevention program. It's been amazing working with them. And I've actually learned quite a lot from that experience. It's been a great experience. Media houses, ZBC, Power FM here coming. We are very grateful for the platform.
Anytime.
You cannot underestimate.
On the behalf of the entire directorate, the ZBC management and the CEO, you're welcome anytime.
It's called board staff and management.
Board staff and everybody. I mean, the more help you can get, the more we can do. You can't do this alone. And even our listeners right now, you guys can also do the little that you can do. If you're listening right now, you are actually equipping yourself with some of this important information, and we're making you aware of the actions that you can go. Now, awareness and action do go hand in hand. What programs have you launched or are currently running into combat addiction?
Yeah, like I said, there are quite a lot.
The one coming up next week?
The one coming up next week under the Global Money Week. So financial literacy and financial inclusion, definitely a great program. We have also been working with WHO on a program called Quality Rights.
Right.
So Quality Rights, it's a free program. Anyone can do it. It's open to everyone, really. And you do it. It's a 16-hour online training. It's self-paced. The insights that you get there are amazing. It teaches on inclusion of people with psychosocial disabilities, where addiction and other mental health conditions fall under. So it really looks at how people can and should be treated, about human rights, about the rights of people with those conditions. So we've been running that program for about 2 years now. And if you'd like to do it, if you visit www.qualityrights.org.zw, www.qualityrights.org.zw. It's an amazing program. With WHO as well, we are running a program called MHGAP. Now, this one is targeting non-specialized healthcare workers, building capacity on how they can respond to psychological conditions. As you may be aware, Zimbabwe has been experiencing a lot of brain drain in terms of the various skills, especially in the healthcare sector. So MHGAP seeks to build skills that would normally be held by a specialist among people who are non-specialized. So it doesn't really make you the top of the range expert, but it gives you some
aware.
Yeah, you are aware, and it then reduces the need for people to visit your high-level institutions. So, for example, before a case needs to get to Ingucheni or to Parinyatwa psychiatric unit or to Ngomahuru or to Salim Gabe, it can be handled at Marlborough Clinic, for example, or Kambuzuma Clinic, where a nurse or a doctor at that clinic would have been given some capacity to at least do some assessment management and follow-up of those general psychiatric issues. So yeah, that's one of the programs.
Wow, nice.
Then the mind skills, this one is quite an exciting one. And would like alcohol, the substance and alcohol will stop you. That's just how it is. And it's easy to stop the start than to start the stop.
Oh, mdarama taura mavhoko akawandisa. Right, ngatitangei pastatement rekutanga. Okay, the codes. Yes, the codes.
So number one, if the person using drugs does not stop using the drugs and the alcohol will stop them.
Chai. Go on.
Davandati food.
Yeah.
That it is easy.
Wealth of wisdom.
It's easy to stop the start than to start the stop.
Yeah, okay.
Zernani usatombotanga.
Because kumira kunononetsa.
Kunononetsa.
Oh, wow.
Jumbled up in my head.
For a family that is going through addiction, these are the words that they need to hear. For all those who need help or want support, your cause, they can reach you on your number right there, 0772 210-665, or you can get on the drug and substance abuse toll-free number 0714 64702. And now, Jacob, I know you got a lot of places to go and a lot of people to help through drug addiction, but quickly, one wise word of wisdom before you leave the studio. I mean, you've been unpacking nothing but knowledge, but yeah, maybe some more.
Yazo Buddha.
Icho.
Less is good, none is best.
Oh my God. Preach, my brother, preach. Thank you so much for coming down to the show, Jacob. We appreciate the work that you're doing. We love the impact that you're making. And I know maybe some guys will say, no, this is so boring. But once you are not in that problem, you do not understand the gravity of it all. And thank you so much for the work that you are doing and the lives that you are saving. May God bless you richly, my brother.
Thank you very much. Thanks.
Guys, you're in tune with Zimbabwe's number one music station, Power FM Zimbabwe. It's 3 minutes before 8 p.m. And yeah, some music just to get you grooving. But I hope you guys learned something. And I hope that you guys are no longer under the shadow of addiction. But now you're also shining your light for others who are in that dark spot. My name is Keith Closer. Don't go anywhere. More coming up next.
Blessings to the man.